Good morning. So at the moment there is a cyclone hitting the coast about 3 hours north of where I live, so it's just bucketing down rain outside, and I had to save some green tree frogs from the pool before they got stuck in there somehow. So yeah, everyone's kind of just relaxing in their houses today, and it's nice to just chillax inside. And anyway, so I guess today I would like to talk a bit about naturopathy and traditional medicine, because it has been brought to my attention since being a part of the alternative health industry that because of the dominating allopathic medicine industry, most people in our Western society don't know about the wisdom and efficacy of traditional healing methods and modalities, or even know what naturopathy is. So I hope I can shed some light on that today. Naturopathy is a traditional form of medicine based on the healing power of nature that encompasses a range of modalities including nutrition, herbal medicine, vitamin and mineral therapy, and lifestyle adjustment. It involves treating the body as well as the mind and the spirit. The naturopathic approach is based on a holistic appreciation of our instinctual connection with nature, and really aims to enhance our self-healing capacities through the use of natural medicines, lifestyle regulation, and really educating and empowering the client. I find it strange that alternative medicine, including naturopathy, Chinese medicine, Ayurvedic medicine, acupuncture, a whole range of other modalities, get this name, considering they are actually the traditional healing modalities that have been practiced for thousands of years and have continually worked to heal people and achieve optimum health when applied properly. There's this common misconception that naturopathy is not evidence-based. Well, I can tell you that about 95% of the subjects that I studied at uni all required evidence-based research and literacy analysis. So naturopathy does encompass evidence-based medicine, but we also have the privilege of practicing non-evidence-based medicine, which allows us to recommend so many more therapeutic options and other effective therapies that maybe haven't been researched yet or have been misrepresented by poor research designs, because the legitimacy of evidence completely depends on the quality and design of the study, which is flawed more often than not and can be based on biased opinions or funded by companies dictating the outcome of the study before it's even started. There are well-designed, non-biased studies that provide true representations, but please actually watch a TED Talk by a guy called Dr. Ben Goldacre about the distortion of evidence, so then you'll see where I'm coming from. I'll include the link to his video in the description section. My housemates are having an awesome time outside. Naturopathic doctors, as per our title, are trained in using natural medicine to treat the underlying cause of symptoms to heal the body. And while there are wonderful doctors out there who have gone on to teach themselves more about the true nature of healing and wellness, medical doctors, as per their title, are trained in medicine and are trained to prescribe medicine to treat symptoms rather than focusing on the underlying cause of the problem. So why do people seek a naturopath more often? Well, when we're unwell, the medical advice we seek depends on what we've been exposed to, so we go to what we know. People are used to seeking advice from doctors because they're born into a doctor's hands in a hospital and their parents take them to see a doctor when they're sick. Similarly, if you're brought up seeing a naturopath, you'll continue to see a naturopath. Traditional forms of healthcare are no longer mainstream, hence the vast extent of sickness currently occurring in this world. And this is because traditional wisdom, I believe, has been undermined and misrepresented by modern drug corporations who are money driven and care more about making money by selling drugs rather than actually helping and healing people. And I've seen this time and time again. And these large money driven companies also convince doctors in training to give natural healthcare modalities a bad rap so they can continue to prescribe their products and take advantage of sick people and keep this destructive trend going. There's just so much corruption in the health industry, and I can talk about it all day, but Considering this, I do think that emergency treatment and surgical intervention is vital and extremely important for saving lives in cases of severe acute illness and physical trauma. A man named René Dubos, who was a microbiologist, pathologist, environmentalist, humanist, said, "To a large extent, all systems of medicine, except those based on modern Western science, are almost exclusively based on a holistic concept integrating the mind, the body, and the total environment." Now, my aim in my career as a naturopath is to help others maintain or achieve a state of optimum health through teaching about our primal ways of living and focusing on prevention, and to really devote my life to learning more about traditional methods of nurturing the body to prevent and treat illness. When we support the body's own natural healing capacity, the body begins to heal itself, and when the body heals, it heals everything, not just one thing. Naturopathy is based on 7 underlying principles. First, do no harm. So use methods and medicines that minimize the risk of harmful side effects. 2, treat the cause of the disease rather than just suppressing symptoms. Educate the patient by sharing knowledge and encouraging the individual to take responsibility for their health. Heal the whole person through individualized treatment by understanding the unique physical, mental, emotional, genetic, environmental, and social factors that contribute to illness, and customize a treatment protocol specific to that patient. Emphasize prevention by partnering with the patient to assess risk factors and recommend appropriate naturopathic interventions to maintain health and prevent illness. And respect the restorative power of nature and support the healing power of the body by recognizing and removing any obstacles to the body's inherent self-healing process. So, what does a typical naturopathic consultation entail? An initial consultation lasts around 1 hour, where the naturopath really delves into understanding the client's body and provides the patient with an individually tailored treatment protocol according to their presenting complaints and specific health goals. We'll also do a series of physical examinations and tests that might include hemiview or iridology, and then the normal sort of physical examinations like blood pressure and things like that, as well as other things depending on the naturopath. I want to stress the importance of having a follow-up consultation, because in the follow-up appointment we can assess the client's progress and how they have integrated their treatment protocol and continue to support the patient and make adjustments to their treatments if required. It makes sense to me to try natural healing options before taking medicine that can cause more disruption in the body. As individuals, we have the power and responsibility to keep our organism in balance by observing a number of simple rules of behaviour pertaining to nutrition, sleep, and lifestyle choices. And the role of the therapists and health professionals is to really assist us in doing this. I personally believe that illness occurs due to a lack or excess. This could be a lack of nutrients, clean air, hydration, a lack of love, or an excess of stress, toxins, food, or an excess of work, just to name a couple. So have a think about any imbalances you might be able to correct in your life to benefit your health. It should also be especially clear that we can't have healthy humans on a sick planet. So protecting the health of the earth is vital for our health and our existence. I believe that integrative medicine is the future and the best way to achieve lasting health and wellness, because it encompasses all the different modalities of healing, where we can choose the most appropriate modality specific for the individual's needs. So I hope this has provided some clarity and shed some light on the alternative health industry and the role of a naturopath. And have a beautiful day, and I will speak to you soon.